Hey everyone, welcome to today's Explainer. We're going to play medical detective a bit and decode the hidden language of your body. You know how we spend so much time looking in the mirror, zooming in on every little imperfection, but we usually just brush them off as annoying cosmetic issues? Well, today, we're completely flipping that script. We're moving away from seeing these quirks as just skin or aging problems, and instead, we're going to start recognizing them for what they really are, a highly intricate internal alarm system that's literally begging for your attention.
Seriously, the outside really is a window to the inside. So rather than just dismissing those minor quirks, like, say, a stubborn cracked lip or a weird ridge on your fingernail, we're going to learn how these external symptoms are actually your body leaving you absolute gold mines of clues about your internal health. Because here's the thing, your body rarely just breaks down silently. It almost always leaves a trail of breadcrumbs right on the surface. Okay, let's dive right in and figure out exactly how to read them.
Section 1. Clues in your face. Decoding your eyes, mouth, and hair.
Now, you might be wondering, are those little bumps under your eyes just a skincare issue, or are they a blood test waiting to happen? Most of us just assume those tiny white or yellow bumps are harmless little keratin cysts. You know, milia, just your skin doing normal skin things. And yeah, sometimes they totally are. But other times, they're an urgent red flag from your bloodstream that you absolutely cannot just scrub away with a fancy exfoliator. If these harmless-looking bumps show up and just refuse to leave, you might actually be looking at something called xanthelasma. And this is wild. It's literally cholesterol depositing right under your skin. It means your body is so overloaded with cholesterol that it's just resorting to storing the excess right on your face. And honestly, the scariest part? These bumps don't hurt. They don't itch at all. They just sit there looking completely harmless while your arteries are quietly dealing with that exact same dangerous cholesterol overload on the inside.
Let's look at a really striking contrast. If you look closely at the colored part of someone's eye, you might spot a pale gray or white ring forming right around the edge. It's called archaeus. Now, at age 70, this is totally normal. It's just a factor of time, and honestly, your body expects these fat deposits eventually. But if you are under 45 and you see this gray ring, that is a glaring alert for high blood fats and cholesterol. Basically, your eye is projecting on the outside what is dangerously building up everywhere else on the inside.
Moving inward just a little bit, the whites of your eyes are supposed to be exactly that, right? White. So if they start shifting to a yellow tint, that's jaundice. It's caused by a buildup of a substance called bilirubin, which essentially means your liver or gallbladder is seriously struggling to process and clear out waste. And because the eye is so pale, this yellowing gives away liver struggles really early on, often way before your actual skin changes color. This isn't one of those cosmetic quirks you just wait and see on. This is a call the doctor this week kind of situation.
Have you ever had those painful cracks at the corners of your mouth, the ones that sting every single time you yawn, and they just flat out refuse to heal? You might be smearing lip balm or ointment on them for months, figuring it's just stubborn dry skin. Actually, scratch that, it's a condition called angular cheilitis. It's really your body frantically waving a flag about missing B vitamins, usually B2 or B12, or a lack of iron in your diet. That little damp corner of your mouth turns into a breeding ground for bacteria, and if you don't fix the internal deficiency, those cracks are just going to keep coming back.
Okay, stick your tongue out. If you see it suddenly carpeted in a thick, scrapable white coating, you're looking at an overgrowth of yeast called candida, commonly known as oral thrush. But here's the catch. The thrush itself isn't the real problem. The real question you gotta ask is, why did your immune defenses suddenly drop low enough to let this yeast just take over? It forces you to look deeper into the underlying causes. Are we talking about a weakened immune system? Maybe a recent round of strong antibiotics, or even uncontrolled blood sugar?
Now, this is one of the most fascinating ones to me. People almost always blame aging or maybe past overplucking, but losing the tail, like the outer third of your eyebrow, is actually known as the sign of Hertog, and it often means your thyroid has slowed way down. See, your thyroid controls tissue repair, and when it's underactive, your body goes into full-on conservation mode. It just stops growing what it considers non-essential, and apparently the far edge of your eyebrow is extremely low on its priority list.
Section 2. The story in your hands. What your fingers and nails reveal.
So your nails should naturally curve down gently over your fingertip. But if they are scooping inward enough to hold a literal drop of water, you've got something called koilonychia. And here is the really unsettling part about this. It takes a very long time for a nail to change its entire physical shape. So this isn't some early warning system. It actually means your body has been starved of iron or battling thyroid issues for months. Your system has been lacking the basic building blocks for healthy tissue for quite some time now. You can actually try this next test right now. Go ahead and put your 2 index fingers together, nail to nail. You should see a tiny, diamond-shaped gap of light shining through right at the base. If that little gap is gone, and your fingertips have widened and rounded out, that's a serious sign called clubbing. Let me be clear, this is not just aging. This indicates your body is actively adapting to chronically low oxygen levels, which usually points straight to long-term heart or lung issues.
We all know that one person whose hands are just always freezing, right? But if your hands and feet are reliably ice cold while everyone else in the room is perfectly comfortable, it's not just a cute quirk of your personality. It's very often your body failing to generate warmth because an underactive thyroid has completely tanked your metabolism. Or it could be failing to distribute oxygen and heat because low iron is ruining your circulation. Your body is basically forced to sacrifice warming your extremities just to protect your vital internal organs. You know, our bodies are just incredible record keepers. Take a look at your nails for deep horizontal ridges running across them. These are called Bowes lines. Because our nails grow at a very steady, predictable rate, these lines essentially serve as a physical calendar. A ridge sitting about halfway up your nail means that a few months ago you suffered a major trauma, maybe a really high fever, severe stress, or a serious illness, and your body literally had to pause nail growth just to survive. You can almost date exactly when your body went to war.
Section 3. Skin and systemic warnings. What your body's surface is screaming.
Dropping down to our largest organ, the skin, often broadcasts systemic, internal breakdowns way before a doctor would officially diagnose them with a blood test. For instance, some people furiously scrub the back of their neck thinking it's just stubborn dirt, but no amount of scrubbing is going to wash away these dark, velvety, suede-like patches. This is a condition called acanthosis nigricans, and it's actually caused by your body pumping out excess insulin to battle high blood sugar. That excess insulin practically commands the skin in your body's folds to overgrow and darken. It's a hugely reliable early visual warning for insulin resistance, and it often shows up well before a diabetes diagnosis.
Normally, a small cut should heal up in about a week. But when tiny wounds start taking forever to close, elevated blood sugar is very likely the culprit. The excess glucose in your system slowly damages your blood vessels and nerves over time, which severely restricts the delivery of oxygen and vital repair materials to the wound. And it's a really dangerous trap, honestly, because that same nerve damage dulls your pain receptors, meaning you might not even notice a severe wound on your foot until it becomes an absolute massive crisis.
Obviously, a bruise you get from bumping into a coffee table is just a bruise. But a cluster of bruises appearing totally out of nowhere with absolutely no memory of an injury, that means your internal clotting system is failing. The culprits here can range from a struggling liver to vitamin C or K shortfalls or even the early signs of a severe blood disorder. Bottom line, a sudden spread of unexplained bruises is vital information that you simply cannot ignore. Look, we all get an itch from dry skin or a random bug bite, but most itching should have a pretty clear cause. If your skin is just screaming with an itch, there's absolutely no obvious rash and it drags on for weeks, especially if it gets worse at night or right after a hot shower, that is an urgent question about your internal organs. It could literally be your liver backing up bile salts under your skin, kidney problems, thyroid issues, or in some rare cases, an early sign of certain blood cancers like lymphoma.
So, the absolutely crucial point here is this. Symptoms don't usually happen in a vacuum. By clustering these clues together, we can clearly see how entirely different parts of your body are actually screaming about the exact same underlying malfunction. Think about it. A missing eyebrow tail combined with cold hands points directly to the thyroid. Cracks at the corner of your mouth paired with spoon-shaped nails point squarely at an iron deficiency. It's like a giant puzzle, and your whole body is wired to the exact same alarm system.
Section 4. Listen to your body. Observation leads to action.
Let's turn all these insights into some real empowerment. Because knowing how to read these incredible signs is completely useless if you don't actually act on them, right? Here is an amazing diagnostic trick you can do right now, totally for free, just looking in a mirror. Gently pull down your lower eyelid. That inner rim should be a strong, healthy pink or red because it's absolutely packed with blood vessels. But if it's pale, like almost matching the skin of your face, that 10-second check is a brilliant window into your blood. It screams low hemoglobin, pointing directly to anemia. Doctors literally use this trick all the time because it works perfectly without any equipment.
So, what does this all mean for us? Well, your body is constantly communicating with you. It's recording its struggles, its traumas, and its deficiencies right there on your skin, your nails, and your face. The next time you spot a weird bump, a cracked lip that just won't heal, or a strange ridge on your nail, I really want you to stop and ask yourself, is this just life, or is my body desperately trying to communicate a deep internal secret? Listen closely, because the outside is always telling the story of the inside.